like a lot of really amazing innovations are dying. I think there's like a lot of reasons why that is. I think one is, at the moment in the US, AI is not reimbursable. So the only kind of play that you can make to a health system when you're kind of selling into them is an efficiency play or productivity play. And it's incredibly hard to actually measure that. You know, other than just, like we call it pilotitis, but like other than doing loads and loads of pilots, there's just not a great way to like actually integrate into workflows and show that, you know, you do save time, you do save cost, you are improving access, you know, the quintuple aim. So there's, I think, that piece. I think regulation is really, you know, I'm head of policy for CHAI, so obviously looking at the US regulation primarily, but obviously EU AI Act is very much like bearing down on the US as well. You know, there's a really, like, in the absence of federal regulation, like a lot of states coming out, and actually it's just a really, if you're a health system that is actually operating in like 7 or 8 different states, they have like wildly different regulations across the states, and so it's incredibly hard. Like, it's just translating a complete paralysis. They don't know what they are liable for. There's a, you know, much more litigious culture in the US than the UK, so you know, they don't know what they're liable for. The regulation's a mess. So what CHAI is doing in this space is bringing forward like private sector-led, you know, industry-led best practice guidance to say, like, in the very unnavigable waters of regulation right now in healthcare AI, like this is what we think best practice for deployment and development is in certain use cases.